Just having a look over the chest wall. Pectoral muscles do appear even and symmetrical bilaterally there, so that's a good sign. Just looking for any areas of significance. If I do find something that is out of normal range, then it could be a sign of inflammation. Just going to feel down along the clavicular nose. Any of this tender at all? Any areas of soreness? We are going to go ahead and start with your lymph node assessment today. Now, I have you in for a complete assessment of your lymphatic system. I'm mainly focusing on the upper body, of course, as this is where the majority of your lymph nodes lie. So, a lot of our examination today is going to be focused on palpation. We're going to be feeling around at the different areas of nodes. You'll feel me kind of palpating bilaterally here on both sides. And I will be taking some measurement as well as doing some manipulation, of course, testing for any signs or symptoms of temperature abnormalities or abnormal inflammation. And then I will be performing a stethoscope assessment, which will allow me to auscultate for any abnormalities internally. Okay, so I think I'm going to go ahead and get started today by performing a bit of a visual assessment. So I'm going to have a look at you as a whole, and I do have a fairly bright light here, so I recommend that you keep your eyes closed for this portion of the examination. Of course, I won't be shining it directly in your face, but it is fairly bright. So I'm going to start here and just have a look directly around your hairline. Now, there are not any lymph nodes here at this area of your face, but I do like to look for any signs of abnormal swelling. So specifically looking around the ear, the external ear, and down over the eyebrow. Now, oftentimes lymphatic abnormalities can coincide with hormonal imbalance, so I do like to look at the hair growth areas and see if there are any signs of notable abnormality here, any areas that appear more sparse or that are missing hair altogether. So just having a look there, as well as over the cheeks, having a look at the buccal section, looking for any signs of atrophy or distension, which is not notable there. And then overall facial symmetry, of course, does appear to be intact. So going to go down towards the clavicle, having a look at the throat, having a look at the thyroid externally, looking for any signs of abnormality or distension there. Now, I did notate in your chart that you've been sick recently, so theoretically there should be no signs of distension if you are healthy and your body is functioning normally. So just continuing my visual inspection, having a look at the chest wall here. Of course, always having a look for normal respiration, which is notable at the abdominal cavity. Now I will do a secondary check for any abnormality or distension at the abdomen. So just having a look over the chest wall. Pectoral muscles do appear even and symmetrical bilaterally there, so that's a good sign. Alright, so secondary assessment here before I begin with any manual palpations is going to be a test for temperature abnormality. So I'm going to test several different areas here. Just looking for any areas of significance. If I do find something that is out of normal range, then it could be a sign of inflammation. So far, nothing notable. Testing at the upper extremity as well, not seeing anything there. Okay. Alright, so I am going to go ahead and place my gloves on at this point so that I can begin with my palpations. So beginning our palpations at the base of the forehead here, I'm going to feel around at the temporal region. Is there any pain or tenderness here at all? No. Good. Okay. So I'm also going to feel right at the earlobe. And of course down below. Feeling at the mandibular joint as well as the mastoid process. So you have several lymph nodes that lie here behind your ear as well as down the sides of your neck. So I'm just going to use circular motion here to feel for any palpable nodes. Feeling directly over the throat. Is there any signs of distension or displacement at the thyroid? So I'm just going to gently manipulate bilaterally here. There should be slight flexibility at the thyroid, which is notable. Down along the clavicular nodes, anterior and posterior. to look for any visual distended nodules. So far not notable, so that's a good sign. Okay, so before I move on, I'm going to do my stethoscope assessment. Now, as I stated, this is going to allow me to have a better look, better visualization, I should say, if there are any issues internally. So all right, so I'm just going to start by having a listen, and I want you to just breathe normally. I'm going to start here at the temporal region, so just auscultating for any audible abnormalities in circulation. So far, I'm not hearing anything particularly concerning, just hearing normal blood flow, normal reactivity to manipulation, which is all very good. Healthy circulation at the carotid artery. Definitely not hearing any signs of occlusion. It's going to listen on this side as well, of course. Okay. So far, circulation is symmetrical bilaterally. No signs of asymmetrical occlusion. I'm not hearing any cause for concern or lack of blood flow anywhere. I'm also not hearing any audible signs of distension. Occasionally, if you do have lymph nodes that are swollen and protruding internally, I can hear mild signs of inflammation, but none of that is notable so far. Okay. I'm going to follow up with some gentle percussion here, so just want to percuss around these areas and see if we can isolate for pain or any signs of physical distension here. So is any of this tender at all? Any areas of soreness? Just continuing my percussions down your arm. No notable signs of inflammation there. I'm going to percuss directly above the pectoral muscles here. And directly above the chest wall. Good. Okay. Do a couple tests here of your throat, Brittany. If I can just have you swallow gently for me. Any pain or tenderness at the throat? No. No. Good. I'm going to hold here directly below the tongue. If I can have you stick your tongue out for me. Very good. Okay, you can relax there. That all looks great. All right. So the lymph node examination of your neck and clavicular area does look okay. Now, I do want to have just a brief look for any abnormal signs of distension above the abdominal cavity here. So I'm just going to have a look over your belly and just see if there are any signs of abnormality or inflammation here. So oftentimes when I find that my patients have issues chronically with swollen nodes or just issues with inflammation in general, it can be due to gut health. So just want to have a look here and test for any abnormality of the abdominal region as well. So just performing my test for any temperature abnormalities, and it does appear that your abdominal region is just slightly cooler than your top portion, but that is okay. It's slightly cold in here, so it's nothing I would say is concerning. No signs of umbilical distension. So I'm going to perform another palpatory assessment. So this time feeling around the abdominal cavity. I'm going to start here below the rib cage. So starting at the first quadrant, moving upwards towards the sternum. Not noting anything here, feeling along the rib cage for any signs of distension. Feel directly midline here. So I come in at an angle and do a bit of a deeper palpation, feeling for any inflammation of the organs. So just flat-handed palpations here. No notable signs of distension there. So I'm just going to palpate directly around the umbilicus. Feeling for any signs of umbilical hernia or any separation of the muscle tissue here, which is So far, not notable. So, Brittany, I'm going to have you take a deep breath in. Very good. One more time. Very good. And one last time here. Very good. Okay. So that feels okay. So just having a look at the skin. Noting any signs of inflammation. You don't have any topical inflammation like psoriasis or eczema or anything that could indicate more of a dietary dysfunction, so that's a good sign. Okay. So I just want to do one last auscultation of the abdominal cavity, so I'm just going to use my stethoscope once again. So I'm going to start here at the first quadrant, just listening for normal circulation, which is present. So I am hearing active bowel sounds. Have you eaten today?
This morning.
This morning, okay. So it is late afternoon now. Very normal to be hearing some activity there. It does appear as if you're digesting well. Do you feel like you get an adequate amount of fiber in your diet?
Yeah.
Okay. So I'm going to percuss as I auscultate, so just tapping along a few areas as I listen. All of that sounded okay. So the very last thing I'm going to do is test for abnormal reactivity of the musculature. So sometimes if there are any signs of inflammation, it can affect your body's ability to perceive certain stimuli. So I have a very sharp wheel here, and now obviously you should be able to feel it as you're not experiencing any neurological deficits. So I more so want to just see your natural reaction to touch here. So just relax and breathe normally for me. This is slightly ticklish. I'm more so just looking for a natural reaction of your abdominal cavity. So you see some healthy flexing there. Very good. That second time with just a cold object here. It's just also looking for any abnormality in reaction comparatively. So All right, Brittany, so I would say that is going to conclude your lymphatic assessment today. Now, the good news is I didn't see any signs of inflammation, so you didn't have any nodules that were palpable. There was a small area of a slight temperature abnormality here near the carotid artery, but that can be normal just with increased blood flow and physical activity, so not particularly concerned about that, but I didn't see any issues with inflammation at the thyroid, which was my main concern for today's visit, so that is a very good sign. And there were no signs of distension at the abdominal cavity either. Okay? All right. So of course, if you start to notice any abnormal symptoms of inflammation, or you start to feel sick, or you notice any lumps or bumps around the throat or neck, I would like you to come back in, but for now I would say you are okay.
Okay.
All right, well, thank you very much. It was nice to see you in the office today.
Thank you.
Thank you. Just gonna wake him up, but he's still. All right, so